So we have some people that have joined. It's not quite 5 o'clock yet, but if you guys have questions, you can put it in the question box, and just in case we can't see all of them, or you can try your best to type whatever. Any ideas, Dr. Amanda?
In terms of questions, I guess really we've got the full gamut here. You can ask questions about OMT, how OMT works with dentistry, how OMT works with orthodontics specifically, airway, bite, phase 1, class 1. I mean, I can even tell my story, how I met you and how this all came to light. I would love to share that story. It would be amazing.
Yeah, so let's start with that. Let's start how we met, because it was kind of random.
It was super random. So I think it was about a year ago, wasn't it? It was like maybe
crazy. Huh?
Well, I'm thinking it's further out than it is. But so the story goes from my perspective is that, let me introduce myself. So anyways, for those followers who know Tamara and her team at Facial Physique and don't know me, my name is Amanda. I'm an orthodontist. I kind of did the normal practicing thing for about 10 years in the San Francisco Bay Area. And then I did a kind of a sharp pivot. There's a long story behind this, but we ended up moving to Hawaii, where my husband's from. He's also a dentist, but he's a general dentist, to raise our kids, I guess, a little bit better, to have a little more balance of life, to hang out with our in-laws a little bit more. And when I was there, I decided that I wanted to do something a little bit different, and I always had a little side hustle. And I don't know, I mean, obviously I think this is a side hustle for you too. You went from clinically, to it's still clinically, but it's something a little bit more independent. So I started helping general and pediatric dentists for the most part, optimize their ortho cases. And, like 10 years ago, there wasn't anything like Molus or any of these other ortho brain. There's a lot of orthodontists that do these type of things. But there wasn't any of us. So I kind of started, it was a lot of Invisalign, but then it kind of turned really a lot into phase 1 interceptive growth modification habits. And the only habits training that we had in orthodontic residency, and I don't even know if I told you this because it's absolutely bizarre now that I think about it, it was the lifesaver technique. Do you know? I'm sure you know the lifesaver technique. What?
No.
You don't know the lifesaver technique?
I'm assuming opening the airway.
No, you just take a sugar-free lifesaver, you stick it at the roof of your mouth, and you hold it with your tongue to the mouth. That is the entire oral myofacial therapy that we did. That's all we knew. And that's all we had to work with. Either that or putting in a habit appliance, a fixed crib. I mean, but adults don't want a fixed crib, and they're not going to do the stupid lifesaver techniques. So, and that's, as you know, that's not really doing anything. It never worked for me. So I'd have these cases, not only my own, but also other doctors where we were just like open bites, tongue thrusts, and I could see them. I know they were there, and the faces were growing wrong, and the outcomes were terrible, and they were relapsing. And it happens to every orthodontist. There's a subset of their population that is just a mess because of habits, and everyone struggles with this. And I was like, I need to have a better way. So I'm going to go find somebody. So I'm Googling, and I found you, and then I reached out, and we had a great conversation. And then I said, okay, I want to simulate what it's like to be a patient, a doctor and a patient from both perspectives. So walk me through exactly what it's like to be a doctor, and we walk the steps, that works with you, and walk me through what it's like to be a patient. I didn't think I had anything wrong with me. So we went through the whole thing, the diagnostics, and you were so cute. You were like, oh girl, this girl's a hot mess. She's got lots of problems, but you tried not to say it because I could tell you didn't want to offend me. But I was like, you're right. I do have problems. Like, I didn't realize that I was speaking improperly. Well, I always knew I had speech therapy as a kid, but I didn't realize that I had major tongue tie, major issues. So I said, you know what? I'm going to embrace this. I'm going to not only talk the talk, but I'm going to walk the walk. I'm going to go through the whole process of therapy, including the surgery, the OMT, all the therapies, the cranial Chiro therapy, which by the way, I went today. So cheers to all my friends at OrthoLab Chiro and Dr. Luke. He's been amazing. I just saw him a few hours ago. He's super excited to watch this as well. It's just, It's really been life-changing for me, and I would have never expected this. So I'm kind of just singing all y'all's praises, and I want to get the word out to all the pediatric dentists, all the general dentists, all the orthodontists out there, and let them know that this is here, and even to consumers, because they may be like me. I mean, I'm probably one of the more educated people on this topic, and I had no idea I had problems, and I had no idea how much my life would change for the better once I went through the therapy. So that's pretty much we're kind of here to kind of talk about it.
Awesome. That was an amazing introduction. I think,
sorry, I have to say hi.
No, you're good. I think the main thing was as a provider, you can see it, but it's not till you go through it yourself that you really realize like, oh, wow. Because I'm a hygienist. And do myofunctional therapy. I didn't know all the same things you knew. I was like, okay, well, maybe that's a tongue tie, I guess. What does that have to do with anything? Right.
Yeah.
Until I myself went through it as a patient as well and was like, wow, I got some stuff. And then you start seeing it in everybody. And then I'm like, oh my gosh, I failed all my hygiene patients. Like, how did I not see all these issues for all these years that I've been cleaning teeth? So, but I think the main thing is just continuing to learn and teach each other and grow together, and getting the word out. So,
Yeah, for sure. For sure. And another thing that we definitely want to talk about, I don't want to just talk about myself, but I also I definitely have a few hygienists that are going to be not from our office. My husband has a few offices and his hygienists are interested, and it's 2:00. They're working right now, but I know they're going to watch it later because I gave them your information. They're super excited. They want to know how they can become an OMT and how does it work in terms of, I guess there's licensure. And I told them there really wasn't, you're already a hygienist, but insurance, all those different things. Do they operate separately from their own doctor? Do they need to ask their doctor permission? Who pays for it? So perhaps, I don't know if you want to start that direction or if you want to start more with let's start with your thing. And then I'll talk a little bit more about what I went through and even loop in some of the symptoms and how I'm feeling better. And we'll talk about that.
Perfect. Yeah. So as far as getting started in myofunctional therapy, there's multiple places you can start. You usually need to be in, remember, a hygienist, dentist. You have to have training in the structural of the oral facial complex. There's the AOMT, that's one of them, the IAOM. There is Sarah Hornsby's My Mentor. There's the Breath Institute. There's the QOM. There's a bunch of different ones. And really, they all get to the same point. You will learn a lot. You will never stop learning. It's a rabbit hole that you're going to jump into. And the field is always progressing. So I'm still taking courses 6 years later. Every year I take a course because new stuff is always coming out. The techniques are always changing. There's new research that's being brought forward. So that would be where I would start. There's also, I have to talk about Airway Circle because I'm passionate about that. I think you were trying to meet with Renata, who is the founder of Airway Circle in Nashville. There is a plethora of places, or I should say a plethora of recordings that have different types of PTs, OTs, chiropractor, myofunctional therapists, ear, nose, and throat physicians. And on Thursday nights, it's free for everybody to listen live on Facebook. So that'd be a good place for your hygienist to start to kind of get their feet wet and kind of understand all of it. And then obviously the training through one of those associations that I was just talking about. And then usually a mentorship of some sort would be ideal. And that's really what I think a lot of us in the field are passionate about, is like having people shadow us so we can help, if they don't want to be a myofunctional therapist as a hygienist, at least know how to screen. Same with, dentists. So stay tuned because there's going to be some cool stuff coming out with the Airway Circle as well.
But they mentor you virtually or they come in person? I mean, I know most of your work is virtual, right? Or you're doing
so a lot of mine is virtual. There are hygienists that are in dental practices. So you can do in person, you can do online, you can do half, you can work for a dentist, you can have your own practice like I do. It's all different. So it depends on what your goal is. I mean, there's hygienists that are like, I don't want to be a business owner. I'd rather just work for somebody and do myofunctional therapy. So you have to see what they want, what the dentist wants. There are dentists that will pay for the courses for them. There are a lot of stuff like the Breath Institute. They have courses that you guys can take together, the dentist and the hygienist to work together. So just reach out. I'd be happy to chat with anybody who is interested. I can leave after this. I'll leave in the comments my email address, or you can help give those to your hygienist, to your husband's hygienist.
That would be great. Thank you so much. Very cool. Yeah, you guys, you should definitely do it. I keep talking to my dentist and I'm like, why do you not consider having OMT in your practice? And I think it really takes the hygienist to kind of nudge the dentist and explain the why behind it. And, in terms of how they get compensated, if it's within an office, that's something that I'm sure they're going to teach you in these classes, how that works. So I don't really know how that works.
Yeah, it is
add revenue to your practice and it adds value, so I'm sure that you'd be compensated.
Yeah, it's a whole body wellness approach. And so I think a lot of patients are looking for those providers. As we get more aware, the patients are more aware, they're looking for providers. I just had one the other day come to me and say like, well, I switched dentists because mine's not in it. It doesn't look at all that stuff. And you do. I was like,
Mhm.
oh, okay. I didn't realize like it's starting to become that where patients are looking for that kind of stuff too.
I believe it.
So.
I believe it. Yeah. And same thing for the orthodontist. So that's fascinating. Very, very cool. Well, thank you for sharing that. So which direction did you want to talk about next? Did you want to talk a little bit more about, you know, signs and symptoms, what things I went through, what it was like to be a provider with me?
Sure. Let's go through some signs and symptoms that you had when you first started and some that were kind of eliminated during therapy.
Yeah, and if anyone wants to hear more, I've been kind of blogging about this the whole way, video blogging. So if they go to, let's see, my website is called, if you don't already know me, is called Straightsmile Solutions. If you go to Straightsmile Solutions, if you go to education, you're going to see a whole section on oral myofunctional therapy now. We're developing it, as well as a lot of archived videos that are there, playlists, or you could even just look within YouTube and they're all posted there. I'm pretty much an open book about what I went through, just because I feel like that's the best way to educate people. Even if, you know, people like my mom watches this and she's like, why did you talk about that? Okay, cool. I'm talking about it to help other people. So that's the ultimate goal. But yeah, sure. I mean, like I mentioned, when I first met with you, I didn't think I had any problems. So we went through all the diagnostics, and your diagnostics are very thorough. So why don't you talk a little bit about how your diagnostics work, just in a nutshell, because I think you probably remember them better than me.
So we basically start with assessing functions. Also, there's symptoms. Then there's symptoms that you may think are not related that actually are. But really, we're looking at the range of motion of the tongue and how is the tongue affecting your sleep, breathing, and then posture of how is the tongue sitting against the roof of the mouth. I don't have my little, oh yeah, I do. So as we discussed in our consult, the tongue should rest completely on the roof of the mouth. So the tip of the tongue should be around here, and the back should also be up day and night when you're not talking. So we assess, like, are you doing that? Are you aware of what you're doing? And 90% of therapy is awareness. And if you're not aware of it, then you can't give me that feedback of, am I breathing through my nose? Are my lips together? Is my tongue on the roof of the mouth? So we want to create that awareness, and it's basically neuromuscular reeducation. So I have her do a bunch of tests to see the range of motion of the tongue. Tests, not only tests, but measurements. We do a lot of measurements, a range of motion measurement. To see if there's restriction. There's also compensations. Is the jaw shifting side to side as the tongue is moving laterally? What does the appearance of the tongue look like? We can't just look at appearance only, which is what I get stuck in with a lot of dentists is, you don't have a tongue tie, you can stick your tongue out. It's like, oh yeah, but if you look at the back part of the tongue, you know, is the floor of the mouth. So when patients lift their tongue up, and hygienists, you can sympathize with me on the patients that you have to like push the floor of the mouth down to get to the tongue side of those lower molars. That's all the compensations of that person's tongue needing or either pulling up the floor of the mouth or the muscles utilizing the incorrect muscles. So we got to look at, you know, is there floor of the mouth elevation? Is the neck muscles being engaged when that is happening? How strong is the tongue on its own? If the jaw, you know, with lateralization, if the jaw is shifting, we're going to start seeing it could be sooner rather than later. It can be later on in life. There are a lot of TMJ issues that are happening. So it's doesn't all happen at once. It's little by little. So we ask a bunch of these questions from infancy onward, the best you can answer, and to get kind of an idea of your oral facial dysfunction and where we can go from there. So everybody's different. Everybody has a chief complaint of why are they coming to see us. I think yours was the TMJ,
Yes.
if I remember correctly. And you just wanted to see, like,
Yeah. I mean, I literally didn't think, I honestly, when I met with you, I did not think my TMJ issues had anything to do with what you do. So, I mean, it took me a while to really get it. And then I was like, is this a hoax? You know,
I know.
But yeah, let me tell you guys about the TMJ issues. So this going through this therapy has literally saved me a lot of money. So I'll explain why. So I'm sure just like anyone in their 40s, you know, I got Botox regularly, probably even from my late 30s, you know, just as preventative. I look good. But so I started adding intramasseter Botox, which is, you know, when you guys bite down really clenchy, you'll feel your masseters puff out, you know, they're right here. And you can feel how thick you are. And sometimes you see people, and where I live in Hawaii, masseter Botox is actually a big thing, just because there's a big Asian population and facial slimming is a very, very big thing. So a lot of, especially Koreans, kind of started it. I think the first time I got it was maybe like 10 years ago. I had a Korean doctor who was like, this is a big thing. You look so good. You have really strong masseters, and it really does slim your face. So I started doing it regularly, and I would say I was probably doing every 4 to 6 months. It's supposed to last 8 months. It never did for me. The amount I would need would go up and up and up. I was probably getting easily 70, 80 units. And if you know the cost of Botox per unit in Hawaii, things are even more expensive. I mean, that was costing you several thousand per year, at least.
Yeah.
And that's a lot of money, right?
Yeah.
Insurance, I wish insurance would cover it. It doesn't. But I mean, I'd wake up in the morning for probably the last 10, 15, 20 years with crazy migraines, headaches. I could tell I was not grinding. You know, the dentist would be like, here, I'm going to make you a night guard. Well, that doesn't do anything if you're clenching. That does nothing. All you do is clench on something, you know, it actually makes the clenching worse. Grinding, yes. Clenching, no. So yeah, there's no grinding at all. So just headaches, just terrible pain, like on a scale of 0 to 10. I mean, and it's so funny because, you know, when I was seeing patients more, I get these women in their 40s and 50s. And I was like, man, our professors would say they're nutty. They're crazy. They're always complaining about facial pain. And I was like, yeah, oh, crazy women. They're like, it's just menopause or whatever. But no, that's not happening. But, you know, they're like, they're crazy. So in my mind, I was programmed that women in their 40s and 50s are crazy. So, I mean, that sounds so stupid. I mean, which is totally not the truth, but the pain is real. That's what I have to get out.
Yes,
the pain is real.
So.
And it's life-changing, you know, to get rid of the pain. So the Botox was working, don't get me wrong, but it's expensive. And every time I was dropping that money, even my husband was like, that's a waste of money, you know. But in any case, we would get the Botox, it would get better for a few months, it would come back, and it was a vicious cycle. And I was like, there's got to be a better way, you know. So, you know, I'd even talked to our oral surgeon, which is a good friend of us. He's like, well, maybe we should take a tomogram. Maybe we can see about doing surgery. And I'm like, oh, I don't want surgery. So I had mentioned to you, well, I wonder if this will help that. I mean, anything that will help that would be amazing. So we found out that, yeah, I mean, I'll let you explain a little bit more about how that works. That was one symptom. And then the other symptom I was kind of hoping, you know, I didn't have high hopes that would help is I definitely have been struggling with speech issues since I was a kid. I was in SLP therapy for a couple of years in grade school, you know, the normal stuff, S's, SH's. I learned to say my words, but if you go back to my old YouTube videos, and I literally have probably 5 to 6 years of archived YouTube videos for ortho stuff, not so many at the beginning, you'll hear, especially when I'm tired, you'll hear a lot of not so great speech. And definitely I'm struggling at times, especially if I didn't wear my retainer, or I was tired. And I was really self-conscious about it because I started speaking more at conventions, and it really made me uncomfortable. So I was like, oh, maybe that'll help. So those were the 2 things I wanted to work on. And I'd love for you to explain to our listeners a little bit more about how that works, and even how cervical, since I don't have my chiro friends here, maybe how that all loops in. Cause that was something I was like,
Sure.
What? You know, this is so weird. So go ahead.
So we looked at Dr. Amanda's tongue, and we decided she was restricted based on functional movement. So we did have her be assessed by, was a periodontist, I believe. Who was the periodontist? I can't remember.
We forgot about our periodontist friends. There's a lot of specialists coming in. Yes.
But knew how to do a functional frenuloplasty the way we prefer. So there is a specific technique that most myofunctional therapists prefer to get the full tongue release, so we can get the full tongue to the roof of the mouth. So we did therapy before. We had to prepare Dr. Amanda for all of her therapy, or for the release prior, get those muscles strengthened, eliminate as much compensation as we could prior to help not only the healing process later, but also the therapy post release. So I got her prepared. She did the release, and that, I think, after the release is when you notice that your speech was changing. I think you're really excited about
night
and
day. Yeah.
And I'm not a speech therapist. I didn't do anything speech. It was just the range of the motion and having the strength of the tongue to improve that. It just naturally did that. So it was cool that that was a side effect. Disclaimer, that's not for everybody. It doesn't always happen. It depends on, what type of things you have, but for Dr. Amanda, it worked really well. And then when we first started as well, I was looking at a lot of her alignment, the way her jaw moved. And I thought, she probably, and because she's an orthodontist and the way we sit in the chair every day on, especially on computers and in the chair, she would benefit from seeing an upper cervical chiropractor. And I had the benefit of meeting Dr. Park, who is here, an upper cervical chiropractor in San Diego. The last probably 3 years, I think we've been talking, and I've had therapy with her for upper cervical. And I was like, oh my gosh, this is so needed in the myofunctional world. Basically, it's looking at C1, C2, and how the head sits on there. And, just a slight little off kilter can off kilter the whole body, but also same thing as myofunctional therapy. There can be compensations in the whole body. So having a collaborative approach, I felt for for everybody, but for Dr. Amanda was huge to see as much success as we have. And she took the treatment. So we were able to collaborate between all three of us and get her to the point where she is now. And I honestly am happy and excited for the results. I didn't expect as well as she had.
But there's more results than that. Those weren't the only results. So you want me to tell people what other exciting things, and I even have one more to add as of today that you didn't even know about. So I'm going to surprise you with the additional result that was kind of like 2 derivations off from the original results. But anyways, so other exciting results that happened that I was not expecting that has made everyone very happy, including my own personal physician, was I lost like a ton of weight during this process and nothing changed. Like I was always an exerciser. I always went walking, running, everything I could. I'm very active, always had trouble, just never was quite the right way I wanted to be. Just figured getting old, right? It just started coming off. So I was like, okay, that's great. To the point where people thought I was sick. People thought I had cancer. And you can see I'm not sick. But I'm like a normal size now, undersize, I'm not going to mix it with normal, but like a size I'm comfortable with. So, it looks good in clothes and everything like that. So that was awesome. I know, like I said, my mom's still like, are you sick? I'm like, no, she doesn't get it. But in any case, it looks good. I'm really happy about that. And then even just blood work, always had like elevated sugar, other things like little, not always perfect, not great, on some medications, try to get it down. Those probably ever since I had kids, it all went away. All the normal blood work, all of a sudden out of nowhere, which, every 6 months. And my doctor's like, how'd you do that? And I've never, he said, even with weight loss, I've never seen somebody's blood work just improve. He's like, I got to repeat it. Awesome. Maybe it's wrong. Please make me repeat it. I'm like, no, I don't think so. But even my chiro doctor, Luke, said, this actually is normal. I've seen it, people get better. It's all like not a vicious cycle, but a happy cycle. Your airway is better. You're sleeping better. Oh, that's another thing. You're feel more rested. I definitely drinking a lot less coffee, feel more rested during the day, a lot more energy, which makes you want to exercise more. Not that I'm actively exercising more, but I'm less, lazy, moving around, getting things done. So that's incredible. Definitely sleeping more. And, for all those of you who maybe have kids or who are older, like sleeping through the night, like kind of goes away as you get older. You just don't, you wake up and you can't go back to sleep. And even this whole week, I've slept through the night, the whole week. I go to sleep and then I wake up, 7-8 hours later. And it's like, I haven't done this since college. So that's like bizarre, it's noticeable. I don't think for 10 years that ever happened to me. You've got kids and sometimes those things happen, but even if you're all by yourself. So that has been amazing. I've just been super happy, and I've been tested for sleep apnea and never had it. There was no sleep apnea, but they just like, oh, you have interrupted sleep. We don't know why. So I'm sure that had something to do with it. It's night and day. Just every day, how you feel is better. And it's just like a new normal, but a happy normal. So, totally worth it. I'm going to tell you the new added bonus.
Okay. Ready?
So I thought for the last 10, 15 years, I had carpal tunnel on this hand, just, computers, dentistry. I was like, oh, I have carpal tunnel, a lot of numbness in the hand and wrist. I just realized I put 2 and 2 together. I was like, that kind of went away. That's weird.
Yes.
And then this week it kind of came back, but I also started getting sloppy on going to the chiro because we were trying to phase down to see. And then it came back, and I asked Dr. Luke today, I was like, do you think it's carpal tunnel? You think it has something to do with my neck? He goes, oh no, it totally has to do with the brachial plexus and the C1, C2, I think he said, or something like that. He goes, nope. And then he did his little thing and it went away today. So I was like, what? That has to do with that too?
I know, it's amazing.
All my like old people stuff, it all went away. So I feel like I just gained like 10 to 15 years to my life. So
oh, good. Yeah. I'm glad you feel that way.
We'll add that one to your list of interesting things that we can fix.
Exciting.
A whole combo of therapy. So that's awesome.
Yeah. I think myofunctional therapy aside, I think all dental providers need upper cervical chiropractor, because I've had the same thing as far as my hands. And that's really why I searched out a lot of chiro, and then found this, upper cervical, which is completely different than the traditional cracking and everything.
Yeah. So we got to point that out. It's a specialist, a subspecialty within chiro, a regular chiro, no. So you have to look up upper cervical chiro in your area. And our area in Honolulu, which is a big metro area, I think there was only a couple, like 2 or 3 when we Googled it. And luckily this doctor is young, very, very young, very interested, very into social media, and he was like on board. So I know he's going to be watching this later. So
awesome. Hi, Dr. Lee.
yeah, been amazing. I'm so glad to share
though.
all this with your listeners, because I mean, I think that dentistry is so much more than just teeth and mouth, and I really want the hygienists. I feel like sometimes when I talk to them, sometimes they kind of feel like they're stale in what they do. I clean teeth, I clean teeth. No,
true.
you do so much more than that. And if your dentist doesn't see that, bring it up to them, and you can always train yourself. Your dentist does not have to do this for you. You can do this yourself.
Yeah, exactly. I think that I was on a call or an airway circle thing, and I think the guy had said hygienists are similar to like the PAs of dental, physician's assistant. And I was like, that is a really good way. All the knowledge that we have with school and continuing education, I think that's a better way of saying it, because we do get stuck in the ways and we're like, okay, day in, day out, we're cleaning teeth. I mean, for some, it depends on what clinic you're in, but you're really looking at the full body, and patients listen to you. They want to know more. They want to know how they can be healthier. So the more you can educate yourself, I can also send out, I probably should have it probably on the website. It's called the FARA 6. It's a form that you can put for all providers. It's like six or eight things to look for.
Oh yeah, I have that. I mean, I don't have it posted because it wasn't my content, but I do have it banked. So if anyone wants to contact me, I give it out to my doctors all the time. Yeah.
Excellent. Yeah. So that would be a good way to start. Yeah. But definitely myofunctional therapy is something that a lot of hygienists, I always recommend them getting into it, because it's kind of a new breath, especially for those who are hunger for more education or changing up just a little bit. So
yeah, totally. 100%. I'm so just very grateful to you, Tamara. I appreciate everything that you've done.
Thank you.
And it's been very life-changing, and I'm so glad to share it with everyone. And I hope that you guys will learn from this experience and maybe go out and help a few other people, and then we can make people healthier and happier.
Yes, definitely. And I have to say that it does take a patient who does their homework. Otherwise,
yeah, that's true. And I haven't always been the best, and I'll admit it. Just
you did good. You did good.
I got a little sloppy, but I know the point of it. I understand what I need to do. So you got to do your exercises. That's the main thing, yeah. And oh, real quick, I mean, I know we're kind of wrapping it up, but maybe can you remind our listeners a little bit about how it works, specifically going back to ortho? What are the steps if you have a patient that say has an obvious tongue thrust and you're interested in getting OMT therapy? What are the steps? How do you find an OMT? I know you've told me about it, but go ahead and share like how it would work for your ortho patient.
So a lot of patients come to me who are in ortho for the first time or for the second time because they've had relapse. Ideally doing myofunctional therapy before or along with ortho, because we can help the muscles, rehabilitate them, and not have them interfere with the orthodontic treatment, actually help the orthodontic treatment. So there are a bunch of dentists who have that open bite, or orthodontists that aren't able to close that because the tongue is in the way. So we have to rehabilitate or do the neuromuscular re-education in order to get the tongue to the roof of the mouth and help prevent that from happening. So if a patient is interested in myofunctional therapy, there's a bunch of us that do it online. My practice is called Facial Physique. You can go right onto my website. You can go on the right-hand corner, there's patient portal. You can do a consult. It's $99 for the consult. We review all your symptoms, and then we'll book a functional assessment if you decide you're a good candidate for myofunctional therapy. There is also, if you wanted to do more in-person, you can go to Airway Circle. There's a directory on there that you can find someone local to you. And then same thing, they'll have their pricing. Some of them, go and do their consultation, functional assessment, and they treatment plan based on what they see. It's not a cookie cutter approach. It's not a one size fits all. And it depends on
prices
patient
could be all over the place. Duration of treatment could be all over the place. Not everyone needs a tongue release. For me, the tongue release, you guys, happened maybe 4 to 5 months in, once I got to the point where I was ready. And for me, that initially that was a little frustrating. I didn't understand that, but now I understand that, because you have to be able to hold your tongue and stretch the frenum and all the attached fascia so that the periodontist or whoever's doing the release can properly do the release. So yes. Maybe you can explain that better than me. I don't know if I said it right.
Yes, no, it's very important. You have to be functionally ready, or else you're not going to get a great release. You always want myofunctional therapy before and after, because you have to retrain those muscles. It's like if you were to get knee surgery, you would need physical therapy. Same idea. Mhm.
And it was a little floppy afterwards. So I remember like, whoa, this is so weird. I can move I could only take the tip of my tongue and go up to my first molar. I remember that. And now I can go way behind the second molar. And when I went to the hygienist last week, she was like, girl, what happened to your tongue? And she was reading. She's like, wow, it's so long. So, but yeah, I mean, incredible experience. And I'll be honest, the release was not fun for that.
Yeah.
Not during the procedure, but afterwards. I wasn't really prepared for the discomfort. So I would definitely take a day or two off afterwards, and just not talk, chill. So
just relax. Yeah.
Yes. It was, but it wasn't that expensive, the process. So definitely, but it's not, you guys, it's not just, there's a lot of dentists who think it's just like take scissors and do this. And it was so much more than that. I mean, she was in there on the bone, like digging around, doing all kind of stuff and having me do exercises while she was releasing it. And she was doing more and then going this way and holding it up and doing this. It was a big procedure. It was not just a snip. So, and I know that you said with kids, it's different. Oh, real quick. Can you go over the difference between babies releases, kids releases? I know we've done this before in other content, but I just want to get this all on one thing, and then adults releases and how it's different.
So adults is trickier because we have all the compensations that we've done our whole life and we've built up the wrong muscle patterning. So it's kind of like peeling back the onion to get to the root cause. So it takes longer, a lot more coordination. Infants, you definitely want to be working with a trained lactation IBCLC. Sometimes there'll be an OT, PT. Anybody that's about 4 years or younger will need feeding specialist in conjunction with the release provider. So again, you don't want to do it only just to release and that's it. You need that therapy afterwards, and those feeding therapists who can be occupational therapists, speech and language pathologists, physical therapists, they are for that age group. And so that it's pretty simple. You have to do the stretches and all of that as well. But the younger you can catch that, the more we can help guide the growth, because form follows function. And if the function is not correct, then the form isn't going to be correct. So if you can get them younger, the better. And then, middle age, anywhere 4 and above, that's where Celine and I, as hygienists, can help with the orofacial complex. Up to my oldest, I think, was 75, and his chief complaint was, my wife doesn't like that I breathe on her with my mouth. Can you help me? And so I was like, that's your chief complaint. Yeah. So it goes from age early to later. You just want to make sure you're finding the right provider for the age group. That's where the Braver Circle comes into play too, is you can find that provider. And anybody who wants to reach out to Amanda, she can forward stuff to me, or reach out to me and I can help find the provider.
For sure. And not everyone's going to have all these specialists like I did. I was just a mess. So there's some people that might only need, the oral myofunctional therapist. They may not need the release. They might need the chiro. You might not need a feeding specialist, but ultimately, so you guys are kind of like the quarterback, right? So you guys kind of do the initial screening and then you give recommendations to what other specialists might be needed to loop in, or?
Yes. Most of the time you need, like I said, the babies need the feeding therapist, or sometimes there's craniosacral, upper cervical. We got to look at the fascial aspect of everything. So a lot of times it's not solo, because we still need the dentist or whoever's doing the release. A lot of times we'll need an ear, nose, and throat physician if we're not able to obtain nasal breathing, if there's obstruction or anything going on there. So say 50, a lot of times you need that collaborative approach, and you want that collaborative approach. You don't want everybody just working, everything's connected to everything. Your teeth are connected to your brain, your skull, and everything. So you want those.
And you were great. You actually found me the right chiro in my area to work to, you actually reached out to them first and said they're expecting me and sent a report. And then you did the same thing for the periodontist. I think you'd already known her, but is that pretty much normal? Like, will they help you find the right specialist, or is that something, I think that might be the hardest part? Okay. Awesome.
Yeah, it is tricky. We, a lot of Googling, a lot of phone calls and stuff, but that's where we have all these other platforms to help connect each of us, because we all speak the same language. We all are different specialties, but we all have, airway backgrounds. So
yeah. It was definitely, everyone was on the right team. I feel like everyone was collaborating. It was an incredible experience. So for the most part, and just one more question, usually insurance is not going to cover most of this, right? Is at the moment, or is that, that's what I thought.
At the moment, I've heard different things that, in the future, it depends on how long that'll take. But usually, depending on the tongue tie release provider, if it's a dentist and you have dental insurance, it depends on them. So, but for myofunctional therapy and fee for service,
Yeah.
and
But I mean,
give.
if you think about like the benefits, I mean, even for me, I said I'm saving $3,000 a year. So I mean, that definitely helped. It was like a no-brainer for me once I figured it out. Not to mention, I wasn't expecting all the health benefits to come with it. But I really do hope that in time that these things will be more covered. Even you guys, orthodontics wasn't covered by insurance a while ago, and now it is. Invisalign wasn't covered by insurance a while ago, now it is. So it takes more consumers to be complaining to their insurance company, but yeah, I mean, that's the tough part. But I mean, I think it's worth just the assessments are reasonable fee. At least you get educated on what you need, and then you can go looking for providers as needed.
Yep, I agree. Yeah, it definitely saves not only, the Botox, but all the other stuff, you're doing the blood tests and all that kind of stuff. Besides the better sleep, you have more energy, all that, that's really what.
Yeah. I mean, hey, I'm getting off some medications, which is amazing. I love the idea of being medication free. So yeah, I mean, my physician said like full on this added years to my life. So I mean, for me, what's a year of your life worth? I mean, definitely being around for your family more. So I think it's totally worth it. But yeah, I think that's incredible. And I just want to thank you so much for the collaborative work that you do, and just recommend that everyone reach out to Facial Physique if they have any questions.
Perfect. And if you're a dentist wanting to know more about orthodontic consulting, Dr. Amanda's your lady.
Thank you. Yeah, glad to talk to you. I'm glad to talk to everyone. Thank you so much, everyone.
Have a good night, everybody.
Hygienists, if you want to know about ortho, I will totally help you out. It's free. Just connect with me. I'll give you whatever information you need. So perfect.
Awesome. Cool. All
right.
Well, we hope everybody got good info.
Instagram live with you. I can't wait to get it posted up there.
Same. Bye.
All right. Have a great evening. Take care. Aloha, guys.